NHS frontline workers, including nurses and doctors on wards and community mental health support staff, could reportedly be next in line to face compulsory vaccination.
It comes after it was revealed that care workers may also be legally required to have the jab. According to NHS England figures, it's estimated that more than 40,000 frontline NHS healthcare workers in England are yet to receive any vaccine, despite a clear message encouraging them to have one.
It is a professional responsibility for doctors to do things which help protect their patients, and I expect that to be a professional responsibility for all other health and social care staff as well.
Well, joining us now is care home manager Donna Pierpoint, who thinks people should be able to choose whether they have the jab, and A&E doctor and broadcaster Dr. Salaya Ahsan, whose father died from coronavirus and says healthcare workers should be made to have the vaccine. Good morning to you both. Dr. Ahsan, I'm so sorry for your loss, and I know that, you know, we've discussed your story and that of your family, remarkable family, on the programme before. Your father died before he could get the vaccine, so you must feel particularly strongly about this.
Absolutely. I mean, it was 3 days after he died that I was actually called by his GP practice inviting him to have his vaccine. What I clearly know now is that one of us, either one of his or his who were not vaccinated at the time, because it wasn't rolled out at that point, gave him the virus, which ultimately killed him. I feel very strongly about making sure that those that are vulnerable across the community are protected to the max. And right now, the biggest tool that we've got is the vaccine.
Dr. Ahsan, I just wonder if I can ask you just to repeat what you said. We just had a little bit of break-up on the line, and what you said was hugely significant to the discussion.
So, yeah, I was saying basically, you know, I feel absolutely very strongly that the one tool that we have right now that is protective for people, the vulnerable people within the community, is the vaccine itself. I know there are concerns about it in terms that it's a new vaccine. Things have been developed pretty quickly, but science and evidence is emerging every step of the way to reassure. I think it's that we use every tool we have in our armoury to protect the vulnerable who aren't able to protect themselves.
And your father picked up, do you know how your father was infected? That was, I think, was the piece of information that I missed.
But what we know, so my father, as I said, was invited for a vaccine 3 days after he passed away. So what we do know is that at that point, none of us had the vaccine. I've had it now. I've had both my doses of Pfizer. At that point, it was either one of us or his carer. None of us had had our vaccine, but we were coming into contact with him, limited contact, but that was all it took for him to catch the virus and ultimately die from it.
And you and your brothers and sisters, all of you work within the healthcare system as well, so there's every chance, as you say, that you were going to be sort of at front line with the virus. Donna, if we come to you, you have 85 members of staff, and I think you've said that 8 of your members of staff have said that they don't want to take the vaccine. You are very pro-vaccine, you've had the vaccine yourself. What were the reasons that those staff members gave for not wanting to have the vaccine?
So they're very different reasons, Ben. Some of them are cultural. Some of my staff are South African and they've never had vaccines at all, and that's been their choice and their life choice. Some of it is for medical reasons. I've got people with severe allergies who've had reactions to vaccines before. And as much as, yes, there is a lot of scientific evidence already out there, we still don't know enough about this vaccine. We still know that it's transmissible even after 2 vaccinations. We know still that you can still catch coronavirus after the vaccine as well. So I just feel it's too early to make this decision, to make things mandatory. And I feel that staff have to have an informed choice. Yeah. And if it's their choice to refuse at this time, when we don't know enough, then I feel that they have got that right.
I think there is something like 120,000 vacancies within the care sector. And the concern amongst people like yourself is that should this be made mandatory, you are going to scare people off from wanting to come into the sector, and actually you could well lose some of those carers that you have already. Do you think those 8 members of staff that you have, should this become mandatory, will turn around and say, I don't want to do this job anymore?
I'm sure they possibly could, and that is a huge concern for me. These 8 members of staff are actually my nurses and carers, and they are excellent nurses and carers. They are staff that I do not want to lose. They are very, very valued members of staff, and I will struggle to recruit into their roles. So I'm not just talking about gaps in health and social care in general and how much we struggle to recruit in the first place. We're on about actually losing people if we actually are going to think about putting this in our contracts and making it mandatory.
Yeah. Well, let me put that to Dr. Assan, because we're talking about 2 sectors here, aren't we? That it's been considered for the care sector. It's also being, we understand, being considered for the NHS. Dr. Assan, that would be a terrible result if we ended up with fewer people in the NHS because people just said, I am not being forced to take this vaccination for whatever reason.
Well, first of all, I think what is involved here is maybe a lack of total understanding and understanding the latest evidence and the science related to it. I just want to go back to what Donna said. Look, there are studies going on and they're happening right now as we speak. Just recently, there was a recent study done in Cambridge amongst healthcare workers where it showed that a single dose of the Pfizer vaccine reduced the risk of asymptomatic infection by 75%. And it's the asymptomatic infections that are really troubling.
OK, I think we have to leave it there because we've... Yes, Dr. Assan, I'm so sorry again, we're just having a little bit of break-up, but a really important statement of the fact of that data. Thank you very much indeed, and Donna Pierpoint, thank you as well. We asked you on Twitter, should all healthcare workers be vaccinated? And an overwhelming majority said yes, 86%, compared to 14%, if you can do the maths, said no, shouldn't be mandatory.
Dr. Hillary?
Look, if you were sending a loved one to hospital tomorrow, would you want them to go to a hospital where all the staff had been vaccinated or none of the staff had been vaccinated? It's as simple as that. If you're looking after vulnerable people whose immunity is already challenged by dint of their condition, you'd want the staff to be as safe as possible for your loved one, wouldn't you? I mean, to me, this is, as Dr. Salaya said, a failure of understanding. We know an awful lot about this vaccine already. How long do we go on saying, oh, it's too early to say whether it's safe or not? It is safe.
We also need care workers and NHS staff. And if they feel
absolutely
like
no,
they
I
can't
understand
do
that.
the job...
But I tell you what, we might have less staff as a result of them not being vaccinated.
They will walk away.
But if people aren't going to those care homes because they're too frightened to send their loved ones there, we won't need that many staff. Of course we need staff and they do a great job, but they need to think very seriously about the decisions they're making. We know a lot about this vaccine already.